We are back on the show on Kababayan Today. We are celebrating all the work that our Filipino-American nurses do here on Talk Tuesdays. Kasama natin si Charmaine, si Marietta, at si Shalom. So thank you so much for willingly and, talking about issues that Filipino-American nurses face in this country. There's so much misconception, right? And all of us know a Filipino nurse. There's so many Filipino nurses, and yet you guys have not had a lot of opportunities to organize yet. So I would like to be able to invite our kababayans, if you know of any healthcare professionals, let's get them to organize, because there's power in numbers, as I said, right? So Shalom, let's, the work that you do for your organization, what are the things that you're constantly doing?
Well, it has a range of activities, basically. We do a lot of recruiting nurses in different hospitals. We do a lot of public information and education among the different members or potential members in different hospitals or clinics. We also do a lot of medical clinics.
Okay, what do you guys do for fun? Do you do stuff for fun? Nagkakaraoke ba kayo?
This is fun for us, basically.
Okay.
Get them out of the usual four-wall mentality, you know.
Okay.
Get them out there, connect them with the people, connect them with real issues of other people, you know, who may not necessarily be nurses. So there's a lot of meaningful and contentment in that kind of work, you know.
I see.
And
I know you do missions as well.
Yes, we do.
What does that entail? How many of you go back to the Philippines, and how does it work?
Well, when we do missions, we basically talk to our members who wanted to go for a medical mission, or let's say a typhoon mission back in the Visayas, you know, or in Davao, for instance. So we coordinate all their activities with our counterparts in the Philippines, and we prepare them for that. We give them orientations, and then they go out there for the medical mission. But before going, we also organize like supplies. We fundraise money to send to the Philippines, because it's a lot easier to buy stuff there than send goods from America going to the Philippines. Because
Really?
it entails a lot of logistics, and plus a lot of, sad to say, a lot of grease money are involved to get those supplies to where you want them to be, you know.
Okay.
So we raise funds for that and send it to our partners in the Philippines, and they buy the medicines there, the supplies, whatever they need for the medical mission.
Okay. Lahat ba ng kailangan ninyo sa mission nabibili nyo sa Pilipinas?
Well, yes, more or less.
More or less, lahat.
Basically, we need a lot of antibiotics, vitamins, you know, those are the more common. Cough medications, gastrointestinal problems, you know. They are all over the Philippines, so you can buy them much easier and cheaper.
Cheaper.
Okay, cheaper there. Okay, please invite our kababayans that are watching to join and come together to be part of your organization. Marietta?
Yes, not only invite, but we work in alliance with a lot of groups. I mentioned one, Panaghiusa, NAFCON. Through NAFCON, there are different organization members that were instrumental in raising a lot of funds during the Typhoon Haiyan disaster. There's also Bayan USA, Anak Bayan, Gabriela.
So there are a lot of organizations that are working together.
Yes.
Let's hope that it doesn't take another typhoon to get all these amazing organizations to work with each other.
I hope not.
Yes. Maraming salamat, Shalom, Marietta, and of course, Charmaine, for sharing
so much
your
for having us
experience as a
here.
nurse. It's really important that we're able to share that with our kababayans para alam nila yung mga chismis na yun, hindi pala totoo. Di ba? All right. Maraming salamat. We celebrate all of you.
Thank you so much for having us here.
Oh, thank you
All the
very
work
much.
that you do.
Thank you.
And the enormity of your hearts. Maraming salamat po.
Oh, thank you.
Thank you so much for joining us on Kababayan Today. Magkita-kita po tayo ulit bukas. Salamat po.